Cardiac arrest is a sudden loss of blood flow resulting from the failure of the heart to effectively pump. Seeing a friend, family member, or stranger suffer from cardiac arrest can be traumatic, but hopefully after watching this video, you will be up to the daunting task of performing high-quality CPR. Hello and welcome. My name is Johnny Martinez, and I'm here to teach you guys how to do high-quality, hands-only CPR. Every year, hundreds of calls are received by Yakima EMS about a cardiac arrest, and in over 70% of those, the caller did not know CPR. Initiating CPR quickly and early has shown to not only save lives, but also improve the quality of the life of those being rescued. Every second spent down and not perfusing blood leads to cell death. Most importantly, cardiac cells and brain cells. The goal here is to stop cell death and prevent further damage. The purpose of this video is to bring more awareness and education forward to the community about the importance of early, high-quality hands-only CPR, which leads to higher chances of living and a higher quality of life. Okay, so the first thing I want to instruct to you is scene safety. If you're watching this video, I'm sure that you have that personality that screams action when you see someone in distress. But I highly recommend that all of you practice scene safety. Look around the room. Obviously, I'm inside a house here. But if you're outside, be aware of vehicles, other people, people with weapons. If you jump in without checking your surroundings, you may end up similar to your patient. This is where it gets a little tricky. If you witness someone fall and lose consciousness and you are by yourself, go get help first.
I need to go get help.
If you walk into a room and see someone down, stay there. You don't know how long they have been down for.
So after you have secured the scene, approach your patient from the side. One thing that I will instruct you differently than most videos is I want you to shout and tap. Ma'am, ma'am, wake up. Some videos suggest shaking, but imagine that the possibility that this patient has neck trauma, shaking them could cause some serious harm. Alright guys, to jump right in now. Step 1. Look at your patient. Try to arouse them. Tap and shout. Ma'am, ma'am. If no response, assess chest rise and fall. If your patient's breathing, obviously they're fine. But if they're not, we're going to go to step 2. Alright guys, for step 2, I have assessed that my patient is down. I witnessed them fall. I see no chest rise or fall. I need to start the chain of command. I need to get a hold of 911 and EMS to come help me. If you have your phone on you, put 911 on speaker. Dispatch will instruct you of how to perform CPR. If there's other people in the room, call out to someone. Be as specific as you can. You in the red shirt, go call 911. Be as specific as you can. Assess your patient. You have initiated someone to call 911. Step 3. If your patient is not conscious, not breathing, check for a pulse. My patient has no pulse. One pet peeve of mine, you see in movies, they reach across the patient's neck to check a pulse. If you do this and the patient wakes up and throws up, if they have blood or attempt to bite you, that is now all over your hand. When checking a pulse, check the side nearest to you. Protects you and your patient. Alright guys, now for the action part. We're going to initiate CPR. You're going to find your patient's breastbone. You're going to put the palm of your hand directly onto that bone. You're going to take your next hand, interlock your fingers. Next, what you want to do is you want to straighten out your back. It's the same as lifting something heavy. If you're bending at your waist or you're leaning too far forward, you're going to hurt yourself. You want to be squared up to your patient over the top and you're going to push down. The key to high quality CPR is you want to be going at about 100 beats per minute. So again, you're straight over your patient, and if it helps, count out loud. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Alright guys, so I hope you enjoyed my hands-only CPR. Again, remember, number 1, scene safety. Assess your patient. Check her color. Look for chest rise and fall. Check a pulse. Remember, don't be reaching across the neck right here. When you're doing CPR, palm of your hand on her breastbone, these fingers over the top, and you're going to be going at about 100 beats per minute. You are continuing this until help arrives or EMS. Thanks again for watching, guys.